Hello, can you hear me?
Oh, Danny, how are you?
Well, hey. Sorry, you can hear me?
I can, yes.
Oh, sorry, just checking. Thank you.
No problem. Hope all's well. I'm right to start at 12:30.
Yep, I reckon. We've got a few attendees present.
Okay. Okay, well, good afternoon, everyone. The time is 12:30. I'm informed that we have a quorum, so I will now declare our meeting open. My name is Ken Weldon, and as board chair, I'm the chair for today's meeting. And as I declare the 27th annual general meeting of our health service open, we would proudly acknowledge the traditional custodians of the land on which we meet and pay our respects to elders, past, present and emerging, and all communities across this nation. I'd like to welcome everyone that's joined us on the Zoom webinar for this year's meeting. And at this point, I'd like to invite Nick Bush, our Chief Executive, to advise of the notice of meeting, the notice of any business received, and the minutes of the previous general meeting. Nick.
Right, thanks, Ken. The notice of meeting was placed in the Ararat Advertiser and the Ararat Advocate on the 10th of February and the 17th of February in accordance with the Health Services Act 1988. The annual general meeting was delayed due to the November state election, and that's whilst it's being held in February this year. There was no notice of business received as stipulated in the advertisements, and the minutes of the meeting of the 26th annual general meeting held on the 23rd of November 2021 were confirmed at the meeting of the board conducted on the 14th of December 2021. Thanks, Ken.
Thank you, Nick. I'll turn to the presentation of the annual report, and as I do so, on behalf of the board, I'd like to warmly welcome you all to this meeting and look forward to sharing our news with you. The annual general meeting is an important date on the board's calendar, and it gives us a chance to publicly thank our staff, our volunteers, the visiting medical officers, and the community for their support and efforts over the year. It also forms part of our engagement strategy and communication with our community on the back of a very well received open access board meeting back in November 2022. And finally, it allows us to report on another successful year and present to you some of the organisational highlights and significant events. Today, I'll base our chair's report on information contained in our annual report, which I'm showing here, for 2021-2022. And that's the report which is prepared in accordance with statutory and government requirements. It's available on our website, and additional copies are available from our offices upon request. As a report, it contains mostly mandated information from the government, but it's been a busy year. So if you please allow me, I'll step you through some of the key aspects of what's been going on, and there's a lot to talk about. So from lockdowns to living with COVID-19, the health service has been at the forefront of keeping our community safe during the pandemic, while continuing to provide quality health outcomes across the continuum of care. COVID-19, as you all know, is a virulent, infectious disease that knows no boundaries. It crosses international borders and it's affected millions of people worldwide. And it's certainly had a significant impact on our country and on our local community. During 2021 and 2022, the board has been supported by the Department of Health, staff, health partners, volunteers, and importantly, the community to continue to provide access to high quality service and programmes. We would acknowledge that it's not always been an easy time, but we're grateful for the respect and understanding that people have had with each other as a health service delivers the best possible quality care. As a board, with the full support of the executive, we've made it a priority to care for staff affected in many ways by the pandemic. We have a great admiration and gratitude for the way in which staff across the organisation have worked diligently to care for our consumers and each other. We understand that working in such challenging conditions has placed an additional burden on many of our people. Following an extensive recruitment process in the last year, the board was delighted to announce Nick Bush as an appointment to the Health Service as the Chief Executive. Nick knows the community well, having been Chief Executive for 8 years prior to moving to another regional health service for a period of 3 years. Working alongside Nick over the last year has been a real positive for me professionally and personally, and I'd like to thank Nick for all that you have done for the health service and all for that you continue to do, so good on you. I'd also like to take the opportunity to thank our previous outgoing Chief Executive, Andrew Freeman, and the interim Chief Executive, Peter Armstrong, for their work and dedication to the health service. Thank you, Andrew, and of course, thank you, Peter, who continues to support us in his role as Director of Clinical Services. Our 5 strategic priorities have been developed by the board, the executive and the staff, and have been endorsed by the Department of Health and embedded into our strategic plan. It is a working document that reflects the Department of Health's priorities of collaboration, modernisation, improved patient outcomes and clinical services reform. From that, we continue to act as the COVID-19 sub-hub for the Grampians region, working collaboratively with Grampians Health, Stall, East Wimmera and Maryborough. Excellent vaccination results have been achieved because our community has chosen to protect themselves and others through being vaccinated and through the follow-up booster shots. However, we are mindful that vaccinations were lower in a number of rural areas and have established outreach vaccination clinics at Lake Bolac, Elmhurst and Wallora. Initial and booster vaccinations have been provided also to the disability providers, correctional facilities, abattoirs and the Aboriginal community. The collaborative approach between our health service, the Ararat Medical Centre and TriStar has earned the praise of the Mayor of Ararat Rural City Council, Councillor Joe Armstrong, who said that the effort and dedication between the doctors, the nurses, along with the community's desire to do the right thing has provided these positive results. Thank you again. The Health Service is an active member of the Grampians Health Service Partnership, and we understand the need to work together as a region to meet the healthcare needs of our broader community. The establishment of Grampians Health, which brings together a number of previously independent health services, has brought forward many opportunities for healthcare sustainability within the region. As a board, East Grampians Health Service has made the decision not to amalgamate with Grampians Health. However, we value the shared commitment between our regional partners to deliver quality healthcare and support each other in identifying gaps in clinical governance, participate in the Regional Morbidity and Mortality Committee for perioperative services, and competency-based training for the existing staff. We're also working closely with Grampians Health Ballarat.
Attention all staff, testing of fire alarms is about to commence. Please ignore all further alarms. I repeat, testing of fire alarms are about to commence. Please ignore all alarms. Thank you.
Safety never stops. Please bear with us for a moment. I think we should all go on mute to protect the audience. I'm looking for the nod to say it's safe to continue. Okay. Thank you for your patience there. So we are working closely with Grampians Health Ballarat to develop a sustainable obstetric workforce. That includes obstetric locum cover provided regularly by Ballarat obstetricians with supervised senior registrars. External non-Ararat Medical Centre general practice obstetrician cover is in place every 4 weeks for a 7-day period. And in 2021 and 2022, 3 general practice obstetricians completed the Rural Generalist Advanced Training at Grampians Health Ballarat, with the exception of 1 trainee who will potentially consolidate in ARAT in 2023. Cardiotography monitoring support is provided by Ballarat Health Services and is utilised as required. Practical obstetric multi-professional training has continued this year to ensure that all midwives working in the birthing suite will be at level 3 status for fetal surveillance education programme accreditation. And this will be achieved at the conclusion of the year. The East Grampians Medical Training Intern Programme has been incorporated in the Grampians Victorian Rural Generalist Programme. And following funding from the Department of Health, a programme coordinator has been appointed. There are currently 20 such candidates at training stages ranging from internships to consolidation of procedural skills as fellowed general practitioners in the Grampians region. 7 participants have been retained across the region since the programme's conception. Furthermore, in partnership with Grampians Health Ballarat, Maryborough and Wimmera Healthcare Group, the establishment of a regional midwife position has been very well received. The position helps support the health service midwifery service with a regional-wide response. The board is very grateful to the ongoing support of philanthropic, I can never say that word, philanthropic trusts. The ongoing support of philanthropic trusts, individuals and organisations, that's to show it's not recorded, to support the education of staff through bursaries, scholarships that ensure the long-term viability and future of our workforce. For the last year, we acknowledge in that spirit the Epworth Healthcare for its bursary of $15,000 to enable registered nurses to train as registered midwives. Lauren Cooper will undertake a graduate diploma of midwifery, and the healthcare from Epworth also supports our organisation with the recruitment and training of midwives, which is essential for the health service to maintain its so important maternity delivery service. The Health Services Building for the Future Foundation awards 3 $15,000 scholarships, 2 from the foundation and 1 in the name of the late Joe Capp. This extraordinarily generous commitment from Monica and Joe Capp have already donated a substantial sum of $465,000 for the installation of solar panels that have greatly reduced our footprint, means that dedicated clinical staff will be able to pursue lifelong learning, which is obviously one of our key values and very important to us. In 2021, the Joe Capp Scholarship was awarded to Gemma Harding to undertake a graduate certificate in physiotherapy. The Building for the Future Foundation Awards went to Marnie Bibby to undertake a graduate diploma in midwifery and Robbie Nicht to undertake a Bachelor of Nursing. The Angela Laidlaw Clinical Scholarship was awarded to Lacey Honeyman to undertake a graduate diploma of nursing specialisation, perioperative nursing. This award acknowledges the effort of the recipient to demonstrate commitment to study in addition to the usual work commitments. The Health Service continues to partner with universities, Western Alliance, ARA Rural City Council and other health services to develop research strategies that support rural health improvement. From this, we actively promote and encourage a culture of asking questions about best practice and clinical care, which leads to the best opportunities for research collaboration. Negotiations are continuing with Deakin University Medical School to deliver a stronger on-the-ground presence at our health service through the provision of an increased number of local students to study medicine and secondary students to undertake allied health or nursing courses. We anticipate that the first local medical student will commence later this year. And our relationship with the ARA Rural City Council has gone from strength to strength as we pursue services and programmes that benefit our community. Together, we will be conducting research activities in pursuit of the Municipal Health and Wellbeing Plan, a strategic plan that establishes overall aims and priorities, protecting, improving and promoting the public health and wellbeing of a local community. We've given our support to a research submission by ARA Rural City and Federation University into assisting chronic illness support. Our philosophy of providing quality healthcare to the community also encourages the community to care for itself. We've been working with regional stakeholders, including the Grampians Public Health Unit, to deliver agreed outcomes of the Grampians Pyrenees Integrated Prevention Action Plan. On this, our focus is on healthy eating, active living and mental health. And that includes working with the City Council and the Grampians Public Health Unit to supervise and monitor the plan's performance. This year, we've invited staff in the community to participate in the development of our 2023-2026 strategic plan survey. From this, we sought perspectives of the community in relation to priorities that the health service should focus on over the next 4-year period. And we've gained some really valuable insights into the thought of the community and the direction of our health service, which will help determine the priority areas as we move forward. From this, the priority areas that we can share are workforce, sustainability across financial, environmental, facilities and infrastructure aspects, technology and innovation, collaboration and partnerships, data and information analytics, best practice quality and governance, consumer and community relationships, and service delivery, models of care and service access. These results are being collated into our strategic plan and endorsed by the board, and we look forward to sharing that with you in due course. Our allied consumer engagement strategy has also had a profound consequence on the effectiveness and quality of the health services we provide. It is our responsibility to ensure we provide quality information to our consumers that is verbal, written, or electronic, that clearly sets out our aims, goals, and values. Along with our strategic plan, the consumer engagement strategy is also a living document, updated regularly to reflect the views of our consumers and to ensure that our diverse community has the opportunity to participate. This is such an important aspect of our service, and we've engaged. It's been great to see the way that that's been embraced when we sought that outreach over the last couple of months. The health service has over 150 volunteers, as well as 4 auxiliaries, and this is a committed group that is a wonderful resource that we greatly appreciate. Not only do they provide an excellent auxiliary service to our acute residential aged care and day centre staff, they fundraise and manage the toy library, and they're also an excellent conduit for providing important feedback that helps us reflect and respond to service delivery. Each person is provided with an orientation, training, information on rights and responsibilities, and this year we've appointed a permanent volunteer consumer officer to help manage this very important volunteer programme. We acknowledge and thank all of our volunteers, the Wallora Healthcare Auxiliary, Murray to Moyne bike riders, cranks and defibrillators, the Victoria Police Blue Ribbon Foundation Ararat branch, the Ararat Breast Cancer Support Group, our Health Services Building for the Future Foundation, the Auxiliary, our Resident Support Group, and the ARC Toy and Activity Library Auxiliary. Thank you all. The health and well-being of staff is obviously paramount in enabling them to continue to provide exemplary care to our community. Our Be Well, Be Safe programme has been rolled out across the organisation and promotes practical, positive mental health strategies to build resilience and happiness. Through this collaborative approach, together with Grampians Health Ballarat and the redevelopment and expansion of our operating theatres, we are now able to support other hospitals to help reduce waiting lists for surgery. And during lockdowns in the pandemic, operations and procedures had to be postponed and cancelled, so we're very pleased to help out our partners in such a way. And there is no better way for our residents to feel good than to participate in gentle exercise conducted by our exercise physiologists, with support from the leisure and lifestyle staff, and a thanks to funding from the Victorian Department of Health to enjoy the benefits of gardening. And the Wallora gardens have now been completed, with residents tending to gardens and using homegrown produce to cook. Our relationship with First Nations people is also very significant to our whole community, and we continue to build clinical and cultural relationships with the Eastern Ma Aboriginal Corporation, the Buja Buja Health Service. In April, we launched an art competition open to all Aboriginal and Torres Strait Islander artists, inviting them to create a work of art that will be used to promote the important work that a health service does every day to ensure it's a safe and welcoming place for First Nations people. The design had to incorporate local Aboriginal culture, as the organisation acknowledges the importance of being respectful to the local traditional custodians and community members. And if I turn to our workforce is the most significant sustainability issue for our health service, as we consider the provision of services for our community into the future. We're very proud of our staff for their approach in supporting each other at all times, but also through the recent pandemic, and their willingness to continue to study, to gain new skills to enhance the delivery of healthcare. As with other rural health services, we have significant vacancies for medical staff, nurses, and allied health professionals. And as with other services, those shortages put existing staff under pressure to work longer hours. Ensuring work-life balance in the circumstances is challenging, and we're investigating a different approach to encouraging universities to lead the development of our rural students, who are confident and able to take medical, nursing, allied health training within their own environment. Currently, the number of students undertaking medical training at Deakin University and dentistry at La Trobe University of rural origin are well below where we'd like them to be. So we are working with the universities to increase the number of local students studying to be medical officers and dental practitioners. The technology and infrastructure is already established in Iraq for this to happen. And our discussions have commenced with Deakin Medical School for the university to have a stronger presence with us and to focus on increasing the number of local students studying medicine and secondary students undertaking allied health and nursing courses. We're investigating the option of build of purpose-built staff accommodation, as the requirement for accommodation for our staff has increased, as a significant number do not live locally, and that's a really interesting prospect for us. Our relationship with Federation University Ballarat remains robust, and we have signed a new agreement for the next intake of nursing students to undertake a diploma of nursing programme. Since 2015, when we introduced this Grow Our Own initiative, 64 students have been enrolled, 4 went on to further study, and 33, I'm pleased to say, have been employed by the health service. Our dental service has recruited a part-time dentist, one of our 2021 dental students, and a part-time locum dentist. With the delivery of a 2-chair treatment van, training for staff is underway. The feedback from schools who participated in the SMILE Squad dental health screening programme has been very positive. And discussions are underway with Dental Health Services Victoria to further expand dental services into all public, primary and secondary schools within the local government area and also into the Southwest region. To help strengthen the sustainability of our workforce in obstetrics and anaesthetics and emergency medicine, we lead the Rural Generalist Pathway for the Grampians region. We currently have 16 candidates in the pathway, and we've partnered with Northern Health to create an anaesthetics training position. The candidate has committed to 2 years in ARAT from consolidation, again beginning later this year. And discussions are underway with Grampians Health Ballarat to have the position offered in Ballarat in a similar vein. Our staff participated in the People Matter survey with very positive results, comparing favourably to a comparison group. In the survey, 94% of staff reported an overall positive response to safety and culture, which reflects our continued support to a culture of safety and quality. Such incidents that happen are all reviewed, and when required, external clinical reviews are undertaken. And participating in external mortality and morbidity meetings further enhances this culture. We've received consistently strong results over a number of years in the Victorian People Matter survey. I'm delighted to say that that has continued in the most recent results, again leading a comparator group of public health services on leadership, accountability, human rights, responsiveness, respect, staff satisfaction, intention to stay, impartiality and integrity, obviously highlighting the commitment to our organisational values. And as a testament to our team and our effort, we received a letter from Ewan Wallace, Secretary of the Victorian Department of Health, acknowledging us as one of the 7 best performing organisations in the space, which is a fantastic result. Well done, everybody, and thank you. Facilities development. Having notified the department of the board's decision to continue to provide our existing services at our Aurora campus, an initial concept proposal to redevelop the site has been prepared and submitted to the Minister of Health. The redevelopment has been identified as a Ararat rural city priority and will work with the government to improve the facilities for residents, staff and the community at Aurora as a priority. And also the development of our second theatre has increased the surgical services we offer into the future. And as many of you know, that was opened successfully in October 2022. In terms of the future, planning has started to identify services that our community needs now and into the future, and the strategic plan development, working hand in hand, will need to ensure that there are medical officers to provide these services locally. This means we'll need to increase general practitioner anaesthetists and nurses to undertake this increased workload. And we will be providing services for our catchment area, and then the arrangement with the state government and Grampian South continue to play a crucial role in operating on patients from the Ballarat area. There is a report for this general meeting. I'd like to ask for that report to be adopted and call for a seconder to that motion.
I'm happy to second that report, Ken. Thank you.
Thank you, Danny. And in return, I'll now invite Danny, our treasurer, to provide the treasurer's report. Thank you, Danny.
Thanks, Ken, for that introduction. So good afternoon, everyone. My name is Danny Walker and I'm the board treasurer, and I'd like to deliver the financial report for the health service for the last financial year. Just for your information, these results are on the website, so they're easy to further reference there. So I'll start by confirming that on the 16th of November 2022, the Victorian Auditor General's Office delivered their opinion on our financial report, and that it presents fairly in all material aspects the financial position of the health service as at the 30th of June 2022, and their financial performance and cash flows for the year in accordance with the financial requirements of Part 7 of the Financial Management Act 1994 and the applicable accounting standards. So well done to the team in having those completed and getting an unqualified report on those. The East Grampians Health Service have posted a small operating surplus of $12,000 for the financial year ended 30 June 2022. This financial result, whilst positive, has come after another challenging year for the health service. The COVID-19 pandemic operating conditions from the 2 prior years continued again in 2022. This has meant that the East Grampians Health Service commenced the year with another deficit operating budget in place. Restrictions on elective surgery saw a sustained reduction in acute activity, whilst this was supplemented by the COVID-19 swabbing and vaccination clinics that we continue to hold throughout the year to support our local community. In response to the ongoing pandemic, the Department of Health continued their support of the health service by reviewing the funding guidelines and delivering specific COVID-19 grants. This enabled East Grampians Health Service to deliver restricted services for the year, fund the swabbing and vaccination responses, and most importantly, to maintain our workforce. Ken talked a bit in his report about how important workforce is to us, and we very much appreciated the support from the health service to do that during this period in sometimes reduced activity. Ultimately, as a result of the department's health support and by managing expenditure, East Grampians Health Service were able to achieve its small surplus for the year. The difficult financial times will continue in the short to medium term as a result of COVID-19. The board has sought and received a guarantee from the Department of Health that it will fund any shortfall for the next 12 months. The board and executive will continue to look at revenue generation and appropriate cost saving measures into the future. We will work in partnership with the Department of Health to balance the budget through growth of program delivery wherever possible. East Grampian Health continue to plan for the future with its ongoing capital development and investment in our staff, who are, as we've already talked about, our most important resource. We continue our program of capital replacement and renewal this year with 5.5 million of additions. This was made up of items of plant and equipment and building redevelopment, as Ken's outlined. Work has progressed on the major redevelopment of the theatre and radiology, and it was completed in October 22. This shows our commitment to continually expanding, modernising and responding to local and regional demand. These major projects have been funded predominantly by the Department of Health, but support has also been received from the Blue Ribbon Foundation and the East Grampians Building for the Future Foundation, plus a number of private donations and requests. I would like to stress that any fundraising, donations or requests received from the community are separately accounted for and do not go into funding operational costs. They are used for capital projects and have an enduring benefit for the community or in specific alignment with the wishes of the donors. We publicly and humbly thank all those who have donated or have been involved in fundraising efforts. Without those efforts, we could not continue to offer the quality of service that we do. So we truly thank you for those. Finally, I would like to highlight the ongoing commitment to staff development at East Grampians Health Service. The health service sees the support of staff through training and development as crucial to ensuring the success of the service into the future. While this can take various forms, we would especially like to thank the generous support of the Building for the Future Foundation and the Epworth Foundation for their scholarship programs. I would like to now recommend the adoption of the finance report to the meeting. So I'd like to move the financial report and call for a seconder, please.
I'll second that, Danny, and thank you for your ongoing efforts as our board treasurer.
Thank you.
So in wrapping up, I'd just quickly like to thank Joe Summers for helping make events such as these go well and keeping us all in the right place at the right time. So thank you, Joe. I'd like to thank my board colleagues, including my predecessor as chair, Panta, for all your hard work, constructive challenge and ongoing efforts on behalf of the health service. It is a pleasure to be in this board. I'd like to thank you all the guests for attending this meeting and showing interest in our health service. It's a very formal process that we have to go through for a general meeting, but as I formally close that formal part, as I'll repeat the message I gave to the open board meeting, if it's important to you, it's important to us. We want to hear from you. Please contact us, contact Nick, any member of the team, and we'd love to have conversations with you to make our promise come real. This is the best we can be, with the best we can be at all times. And I'd like to declare the meeting closed and thank you for your time.